obstetric bleeding is that bleeding that occurs due to obstetric issues. Okay, so we divide obstetric bleeding into three parts. They are mainly two, but I just added one and I will explain that. Antepartum hemorrhage, during pregnancy hemorrhage, postpartum hemorrhage, after pregnancy hemorrhage, and first trimester hemorrhage. Okay, first trimester hemorrhage, the most common causes of first trimester hemorrhage is either ectopic pregnancy or abortion, okay, or it may be normal pregnancy bleeding. Okay, so it is ectopic pregnancy, abortion, or bleeding in normal pregnancy due to any cause. Okay, postpartum hemorrhage, and we will speak on postpartum hemorrhage in a separate lecture, is due to what we call 4 T's. Okay, atonia, we will talk about that. Okay, our subject today is antepartum hemorrhage, and antepartum hemorrhage is the genital tract bleeding after the 24th week to just before delivery. Okay, so it is in the third trimester. It is genital tract bleeding in the third trimester or after 24 weeks, okay, to before delivery. So the period is between 24 weeks to delivery. Okay, so this antepartum hemorrhage constitute about 3 to 4% of all pregnancies. Okay, and it is more in multiparous than in primary, 3 times more in multiparous than in primary. What are the divisions of antepartum hemorrhage? I just divide the antepartum hemorrhage in non-obstetric causes or obstetric causes. Okay, you have always to rule out non-obstetric bleeding in antepartum hemorrhage or bleeding. Okay, non-obstetric causes like cervical causes, vaginal causes, congenital bleeding, or unknown entity. Cervical causes like cancer may cause bleeding, cervical polyp, cervicitis, okay, though it's rare but still could be. Okay, vaginal laceration or vaginal cancer, congenital bleeding tendency, or unknown causes. You have always to exclude these non-obstetric causes. What about obstetric causes, which is our subject today of antepartum hemorrhage? Obstetric causes of antepartum hemorrhage, I will start from the most important one and the most common one, abruptio placenta. We may have what we call abruptio placenta or placenta previa, okay, or what we call vasa previa, uterine rupture during pregnancy. The last two actually are rare, but they can happen. Okay, the first two, abruptio placenta and placenta previa, are just more common than these two, much more common. Now let's move to talk about abruptio placenta in details. Okay, what is abruptio placenta? Abruptio placenta actually is a premature separation of normally sighted placenta. In this definition, every word has a meaning. It is a premature. This is the first word to remember. Okay, it is a premature separation of normally sighted placenta, not low placenta, for example. No, it should be normally sighted placenta separation. Okay, so it is a premature separation of normally sighted placenta. Why did I give the normally sighted placenta number 2? Because we a lot of times students just forget this thing of definition, the normally sighted placenta, but separation will never be forgotten. Okay, So I just want to highlight that normally sized placenta is an important part of the definition of abruptio placenta. Okay, as we said, it is the most common third trimester cause of bleeding. Okay, now let's move to the risk factors of abruptio placenta. Why placenta may separate from its normal site. Okay, the risk factors of abruptio placenta are divided into predisposing factor or precipitating factors. Okay, predisposing is just have a longer term effect on the abruptio placenta. Precipitating factor is the direct event that precedes the abruptio. Okay, so predisposing factors, the most important predisposing factor of abruptio placenta is hypertension, and actually hypertension is the most common factor, with 50% of patients with abruptio placenta will have hypertension, either chronic hypertension or preeclampsia with even rate. Okay, 25%. So hypertension is an important predisposing factor of abruptio placenta. The previous case of abruptio placenta is very important also. Okay, with a rate or percentage of 10% for the first pregnancy after or of history of one abruptio placenta, and 25% for a history of two previous abruptio placentas. Okay, so hypertension and previous abruptio placenta is very important two factors of abruptio. Okay, smoking also is very important, though smoking is a protective factor for preeclampsia. Not really that protective, but it is a protective factor for preeclampsia, but it is a risk factor for abruptio placenta. Okay, old age is a risk factor for abruptio placenta. Anemia, sickle cell anemia patient may come with abruptio placenta. Cocaine administration. Okay, I just want to make it easier on you. Things that you take and may cause you abruptio placenta is like cocaine, smoking, alcohol. Okay, alcohol. And conditions that may predispose to abruptio placenta is hypertension, a previous abruptio placenta, and situations is like an old age of the patient. Okay, so these are the predisposing factors. What about the precipitating factors? What things may happen that cause abruptio placenta? A trauma, direct trauma to the abdomen of the patient may cause a separation of the placenta, of course. Okay, RTA is important. It is just a trauma. Okay, like premature rupture of membrane with polyhydramnios. And what really happens in this situation is that the patient has a big amniotic sac with a lot of fluid, polyhydramnios, and suddenly the membranes ruptured and the fluid discharged from the amniotic sac, and the baby just pulled the placenta down, and that may cause abruptio placenta, of course. First of the two twin delivery. Okay, the first one delivery may cause abruptio placenta to the second one. Okay, external uterine rotation, the maneuver of rotating the baby into the uterus externally. Okay, chorioamnitis infection may also cause abruptio placenta. So these are the predisposing factors and the precipitating factors of abruptio placenta. They are all risk factors. Okay, now let's move to the classification of abruptio placenta. How do we classify abruptio placenta? We have two methods of classification. The first one is classifying abruptio placenta by grades, and the second one is by severity. Okay, so we just classify abruptio placenta to 0 grade, 1, 2, 3. In 0 grade we have no symptoms at all, no symptoms, just a retroplacenta close. Okay, so we open the placenta and we find a retroplacenta close. In the first degree we have pain and a bleeding and the clots. So we don't just have a clots, no, we have symptoms, a bleeding and pain. In grade 0 we have no symptoms. In grade 1 the distinctive thing is to have symptoms. In grade 2 we have like just like grade 1 and 0, pain, a bleeding and retroplacental clots, and also we have fetal compromising. In grade 3 we have like just the three previous grades and maternal signs in addition to maternal signs. Okay, so these are the grades of abruptio placenta. What about dividing it according to the severity? Okay, we have mild symptoms abruptio placenta with no distress. Okay, the second is moderate abruptio placenta. In moderate abruptio placenta, less than or more than 25% of placenta is detached. Okay, more than 25% of placenta is detached, and blood losing is less than 1 liter. We have hypoxic baby, and we have mom that is shocked. Okay, so two things about the placenta and the blood, and one thing about the baby, he is hypoxic, and one thing about the mom, she is shocked. The blood losing is less than 1 liter. The placenta detachment is below 25%. In severe abruptio placenta, we have most of placenta is detached. In moderate, just 25%. In severe, most placenta or all placenta is detached. Okay, more than 1.5 liter blood loss. In moderate, we have less than 1 liter blood loss. Okay, mom is with renal impairment, not just shock. The shock will cause renal impairment to mom in severe cases, and the baby will not be just hypoxic. No, he will suffer in most cases intrauterine fetal death in cases of abruptio placenta. Okay, in the next video I'm going to talk about diagnosis of abruptio placenta and the lines of management of abruptio placenta and the complications. Thank you for watching. See you in the next video, abruptio placenta 2. Okay, thank you.